Yeah, in the journal Circulation, which is a major cardiology journal, we know new anti-inflammatories, the over-the-counter ones, Aleve, ibuprofen, but also the prescription one, Celebrex, increases the risk of heart attack and stroke when taken long-term. This study was done in people who had a history of heart attack, showed that after taking it for a week, their risk of heart attack and sudden death went up 45%.
That's pretty large number, isn't it?
You know, when you're talking about big numbers, it's not a lot of people, but again, you know, just simply increasing that risk after taking it for 1 week. And so, again, that was only people who had a risk or had a history of heart attack. But we've got to look at this and realize, I mean, these are over-the-counter medications, and we've always sort of looked at them as very benign things we just take for an ache or a pain. We're going to use them long-term. I mean, and now long-term has to be thought of in weeks or months. You know, what are we doing to our risk of cardiovascular disease? So really lean more toward the natural anti-inflammatories that don't carry that risk. Matter of fact, they may decrease the risk of heart attack and stroke. Things like fish oil, turmeric, and Tylenol is a pain reliever. It's not an anti-inflammatory. It does have some liver side effects, but it doesn't have that cardiovascular side effect like the traditional anti-inflammatories.
So what would your advice be to someone that may just use this on a not common basis? Should they still continue to do it or still keep this stuff in mind?
Well, I mean, I would try to shift toward turmeric and use that as needed. I mean, we talked about a recent study a couple weeks ago that showed that it's good for tendinitis, inflammation of the tendons, ligaments, and so you can use it for kind of as needed stuff, turmeric that is. You know, I'd say, you know, you're probably not putting yourself at incredible risk if you're taking it here and there, but if you're looking at anything, you're going to be taking something for a couple weeks. I think you're going to want to look for alternatives.